Okay. Am I audible? Hi, good evening, everyone. I hope people have started joining in. So today we will be talking about a very interesting and probably among us women a more trending topic of late, and that is egg freezing. Now, so in life, we do have a lot of goals. We have a lot of things that we want to achieve. We need the time to achieve that. But often, and more often than not, women are always told that, your biological clock is ticking. Now you better start having children, get married. But in today's day and age, that is not the same story for everybody. I mean, I am one of them. And so it's a constant pressure that you have to have children, you must do it at a certain age. Once that is gone, there is no other option. So fertility is something which is always ticking away, and we have to keep up with that race. Now, in between, what we want is something of a choice, something to choose, our way of life, our pace in life, and our goals in life, right? So to be able to choose that, we need certain things that can help us. One such thing of late, which is coming up and which is getting more popular, is egg freezing. And to tell us about this, with us is our fertility expert, Dr. Priyanka Yadav, and she comes with a host of experience. She has 11 plus years of experience in fertility, and not just female fertility, male fertility, all sorts of gynecological issues, problems that can sometimes cause a lot of problems in our fertility journey. So, who better than an expert to help us understand this topic better? So, in this short intro, let me also include the fact that you have had the privilege of the tutelage of some of the most known names in gynecology. I mean, Padma Shri, Dr. Kamini Rao. Wow, what an achievement that was. So I'm sure you have learned a lot of new age things, and you would be able to tell us what these new age ways of controlling our lives and deciding our destiny can be. So to start with it, let's just explore. And I mean, over to you, ma'am. You can you just start by explaining what is egg freezing, because the name itself sounds a bit scary.
Shouldn't be scary about egg freezing. It's a process wherein women's eggs are extracted, frozen, and stored for future use. Typically, for those female who wants to delay their pregnancy because of any kind of their personal or medical reasons.
Okay.
Now, of late, we have seen many celebrities who have frozen their eggs.
Okay.
Like
Right. Priyanka
recently, we
Chopra
have
just
heard,
came up. Yeah.
yeah, Priyanka Chopra has a baby now. She has frozen her egg at a younger age.
Hmm.
Also, Ridhima Pandit has also frozen her egg. Ekta Kapoor has frozen her eggs at the age of 36. Rakhi Sawant. Many foreign personalities has also done egg freezing,
Okay.
like Kim Kardashian and Paris Hilton.
Wow.
So it's
Okay.
very much common nowadays. Even in general population, also many young girls have approached us to my
Right.
clinic
Right.
regarding inquiring about egg freezing.
Uh-huh.
And yes, it's very much common nowadays. We should not be afraid of egg freezing.
Right. So to understand it better, I mean, why not tell us why egg freezing is done in more of an important aspect. Why is it done? And especially, are there specific conditions where egg freezing is necessary? If that can also be something that I would, want to explore.
So egg freezing is done usually, as I told you, to preserve women fertility.
Hmm.
As the woman's age advances, it's
Hmm.
proven fact the number of eggs will decrease, her
Okay.
quality of eggs will also decrease.
Okay.
So if timely intervention is done and at a younger age group she frees her egg, so there will be very good chance of her to use those egg in further in her
Okay.
later age group and get
Okay.
pregnant with them.
Okay. Okay.
Yes.
So, in that case, is it only uh, feasible for somebody at a younger age to do it? I mean, who should opt for egg freezing,
So
essentially?
yes, we can divide into two things. Like egg freezing basically is one is social egg freezing,
Mm-hmm.
another one is because of your medical reasons.
Okay.
Social egg freezing comes like female wants to delay their pregnancy.
Right.
Reason she wants to first settle down in her life.
Right.
She's having a career which she wants to achieve something in life. Later
Right,
on,
right.
some days she
I
will
mean,
want to
most of
plan.
us are facing the same
Yes.
problem.
Secondly, if somebody has not found the right partner, waiting for the right partner to get married, getting settled down, then they will plan their pregnancy.
Mm-hmm.
Mostly these two reasons are there for social egg freezing.
Mm-hmm.
Secondly, comes to our medical reasons. So if any at a younger age or later in her 30s, she is
Mm-hmm.
diagnosed, God forbid, by any kind of cancer,
Okay.
and she has not yet having any children or no pregnancy as such has happened till now.
Mm-hmm.
And it's proven that if a woman undergoes any kind of cancerous treatment like chemotherapy or radiotherapy,
Mm-hmm.
she might land up having decreased enteral follicle count, decreased
Okay.
ovarian reserve, because it
Okay.
has proven that decreases the number of your eggs. Plus, the
Okay.
quality of the egg also deteriorates very rapidly.
Okay.
And also, in the case of any kind of pelvic or ovarian surgeries like endometriotic surgeries,
Mm-hmm.
our egg count also decreases drastically.
Okay.
So I will always advise these female they should not lose hope, and I will
Right.
also ask my onco specialist also
Right.
they should have they should ask their patients to just meet an infertility specialist to under before going any kind of chemotherapy, radiotherapy, or
Mm-hmm.
any cancerous treatment,
Mm-hmm.
so that one meeting we can at least advise them,
Mm-hmm.
and we can urgently take up for egg extraction. We can
Mm-hmm.
freeze them later, and they can undergo their treatment. Once they are hale and hearty, they have got out from the cancer,
Right.
they can
Right.
come back to us,
Ah.
and we can give them an opportunity of having their pregnancy with self eggs.
Right. Right.
Yes. So these two reasons are
Then
most common.
I would definitely add the egg freezing is quite a blessing
Yes.
because I'm sure you're also aware India is rapidly growing up as the most reported number of cases of breast cancer have come from India.
Yes.
Cervical cancer has pushed up, ovarian cancer has pushed up. I mean, it's problem for us women everywhere.
Mhm.
So given this as a thing, I mean, it's not just that people in their old age are getting cancer, young people are getting diagnosed with cancer, and that is
Yes.
becoming so common. So this is nothing less than a blessing for them. I mean,
Right.
this is an amazing opportunity that you can
Absolutely.
actually
Yes. In earlier
have.
ages,
Yeah,
people were not very much aware of egg
right, right,
freezing. Only after the onco treatment, they used to come to us and, okay, we now want to have children. We are healthy. But when we used to do a blood test and ultrasound, we used to have a sorry figure in front of the patient. Now the egg reserve has fallen down so much.
right.
The quality is not, might not be good.
Okay,
uh, we have to explore other options.
right,
But
right,
now, in today's scenario, the awareness has also come up.
right,
People are coming to us. Even
right.
today, also, I have a patient with egg freezing in my OPD.
Okay,
So I believe we should be doing it, and there's no any kind of you should not be afraid of it.
right,
Meet your doctor for it.
right.
Yes.
So just to understand, egg freezing, is it a part of the IVF process? I mean, how is it done?
So yes, it's more or less like an IVF only.
Okay.
We call the patient after doing a baseline evaluation.
Mm-hmm.
We start our stimulation on day 2 of our cycle.
Okay.
Patient comes to our clinic on day 2. We do a scan, or
Mm-hmm.
if some blood tests are indicated, we'll do the same.
Okay.
There are multiple injections, roughly from varies from 8 to 12 days.
Okay.
Once daily injections are given, these are
Mm-hmm.
kind of a hormonal injections.
Okay.
Once the eggs are mature enough,
Hmm.
we give a trigger shot,
Hmm.
and then under short general anesthesia, we extract the egg vaginally. The eggs are given into laboratory where the embryologist do the egg freezing by vitrification method, and these are eggs are stored for how many years you want. They are stored with us in the lab,
Okay.
and later on we can use those eggs once you are
Okay.
ready for pregnancy.
Okay. Sounds like a very tedious process. How long does it take? I mean, is it painful?
Not exactly. As such, the egg extraction is under anesthesia, so
Okay.
you'll not feel anything.
Okay.
Mild abdominal discomfort is there, which
Right.
is almost bearable, and we
Okay.
give some analgesic also. It's a
Okay.
very mild and tolerable pain, nothing much.
Okay. So, yeah, mostly I guess now then the whole thing lies with whom you choose to store your eggs with, right?
Oh, yes.
Right. So, how do we go about choosing? I mean, what should we be looking at? Suppose today I'm
Mm.
convinced after hearing from you, I want to freeze my eggs, right? So what should I look for in a place where, or a institution where I should approach, or a doctor I should go through? What should I look for in a place that would probably be storing my eggs? What are the things I'm looking for?
Yes, when you are thinking of egg freezing and you want to choose your center or a doctor, you should first look out how about the hospital or the infertility clinic, how old it is, what's the success rate of the hospital, how learned are the doctors, whether the embryologist and the whole team is learned people. There are 24/7 embryologists there. There are many things into it. First, meet your doctor, just see how you are feeling, inquire about the cost, about the procedure, everything, and then you can make up your mind whom you want to choose for egg freezing.
So basically, if I'm doing a recap of all that I've heard, so first of all, I go to my doctor,
Yes,
ask him or her whether I should get my eggs freezed now,
right.
whether they're viable to be frozen now. Then, with their help, choose the right kind of place that would be responsible for my eggs. Because,
You
say, 10
basically
years
have
later,
to
I
meet
want
an
to take it up.
infertility
Yes,
specialist.
yes, yes.
Yes.
So, basically, that's the step. And the procedure is not so painful, not painful at all.
Only mild injection pain and
If
the
you're scared of
discomfort of
injections, well, we can't help it. But
it's not so
apart
much
from
painful.
that,
Nowadays we have purified injections, hormonal injection, they are not
okay,
so much painful.
great. So the doctor has spoken. Now I'm happier. Now I get there. The procedure is done. It is a 2 week procedure.
Somewhere around 8 to 12 days, depending on the body, it varies actually.
Okay. And then they retrieve my eggs
Yes.
and they keep it for later. And later on, I will come and I'll say
Whenever
that
you're
I'm
ready,
ready.
yes,
Let's have kids. Let's
yes.
be pregnant. Okay. So essentially, if you were to summarize, what are the benefits? And the reason why I want to say this again is because all the process, entire procedure, it can be overwhelming. But end of the day, you need to know what are the benefits of egg freezing.
See, benefits of egg freezing. Like when a female crosses her age of 35 years,
Hmm.
we say the biological clock has started ticking.
Hmm.
And as the age will advance, like from 35 to 40, the female's egg will number will decrease drastically in case of numbers and the quality also. And later age, if she conceives, even naturally also we have seen, if later age patient conceives, there are high chances of miscarriages,
Okay.
high chances of congenital anomalies in the babies,
Okay.
and it's very much a matter of concern
Hmm.
if you are conceiving even naturally also later age by
Okay.
if you are lucky enough you conceive. And so in that case, if you have frozen your egg at the age of say 30, 32,
Hmm.
and you're planning to getting pregnant at the age of 40,
Hmm.
but your egg is biologically of the age of 32, so you will have comparatively lesser chances of miscarriages,
Okay.
lesser chances of any congenital anomaly in the baby, and also higher chances in terms of IVF success rate.
Okay.
As we know, with advancing age, your success rate also decreases.
Mm-hmm.
It's not always the same if I'm doing for in 30 years and if I'm doing for 38 years.
Okay.
Success rate also drastically decreases.
Okay.
So it's always the timing is important. Right time,
Right.
you should intervene.
Right. Uh, I think that is pretty much a lot of coverage on the matter. And the fact that egg freezing is something of a viable option, especially with the growing cases of medical complications that we
Mhm.
keep facing. So yes, I think this is it's essentially a safe procedure, right?
Yes, it's very quite safe.
It's
No
it's
need
a
to
safe
worry at
procedure.
all.
You don't
Yes,
need to worry at all,
yes.
right?
Choose the right doctor and
So
it's always safe.
it's all dependent on me, my body, and the doctor, right?
Okay, yes, you can say that.
So another concern that I want
Yes,
to really address, fertility is a very sensitive topic, right?
mm,
I'm sure you come across many patients,
right.
and I would like to know what kind of mental preparation should I have to get into this? Because see, for egg freezing or not, ultimately I'm planning a pregnancy on the long
Mm,
run, right?
right.
And so what should be the mindset? What is the amount of counseling that you put in for the patients? How do you because it's
Mm,
we
right.
essentially, I feel, for any fertility concern, there should be a judgment free space, right? So as part of Birla Fertility and IVF, what do you see among your patients, and how do you deal with this anxious bit that
Yes,
we
yes,
have,
yes.
right?
As a fertility doctor, I always believe patient not only looks for your expertise and the latest technology you have, they also look for that their treatment should be in a hand of a doctor who deals with them like a very good friend.
Mm-hmm.
They also need a emotional and psychological support
Mm.
besides obviously the treatment and the technologies. So I always have believe you should be stress free. Meet a good doctor. They will provide you all kind of supports. They'll assure you. They will tell you about how the process is done. And as I've told you, it's very safe process. No need to afraid. You should not afraid from anything.
Mm-hmm.
And when you will meet us, I'm sure it will be good. I mean, you will have a very good emotional and psychological support with us also.
So it
Yeah.
is all heart, all science, right?
Yes, yes, all heart and all science. And you should really come up and at least go ahead with egg freezing if you really want to delay your pregnancy, because later it will be difficult even for us also. If you approach us late,
Hmm.
near to 40s, it will be really
Right,
difficult. As the science have also studies have many studies have been published. If I'm freezing your egg at the age of 32, say,
right,
I'll need only 10 to 14 eggs
right,
to give you a good chance of pregnancy.
right.
And if you are coming to me at somewhere, I say 36 to 38 years, I
Okay,
will need your 20 or more eggs to
okay,
give you equivalent good chance of
okay,
pregnancy.
okay.
And suppose if somebody makes up the mind at 40 years
Hmm.
of egg freezing, it's no point because I'll have to store more and more eggs,
Mm-hmm.
and ultimately will not give you that much kind of success rate which I can have at the younger age group.
Okay.
As I told you earlier, because as the egg will mature,
Hmm.
the will be increasing chances of anomalies, increasing chances of miscarriage,
Hmm.
results also decreases.
Hmm.
So
All right, I think we can go on and on about this,
yes.
but I'm sure some of us must be having some queries. Let's find out what are the queries that have come up in the questions, if at all.
Mm-hmm.
Any questions? Uh, what are the questions that we have right now? Any particular questions that probably um, most patients come up to you with concerns? Any very top of your mind? What are the concerns they come up to you with?
So, yes, apart from whether the egg freezing is safe, we have discussed that. They usually ask me, does this guarantee pregnancy?
Okay,
Or what is the roughly cost for it? How much duration we can freeze?
right.
So, if you ask me for how many days my eggs can be frozen,
Mm-hmm.
Government of India allows us for mostly 10 years. We can
Okay,
freeze your gamete till 10 years of the
okay,
age.
okay.
But it's not like that. Ki if I've frozen for 5 years or 10 years, the results differ. No,
Hmm.
it doesn't matter.
Hmm.
The success rate will be the same.
Okay.
It depends on you for how many years you want to freeze your eggs.
So what
We
I
can go
understand is,
maximum till 10 years.
if I freeze my eggs, say at 25,
Yes.
right? I'm freezing my eggs. They will be viable as 25-year-old eggs.
Yes, yes.
Okay,
Even if you want to pregnancy at 35,
right.
the egg will be of age of 25.
Okay.
Yes.
So it helps to do this process earlier, actually, because we are giving it a better chance to survive.
Yes, better
Okay.
chance of pregnancies as well.
Okay. Okay.
Yes.
So does it
Second.
affect fertility in the long run? Suppose today, like you said,
Mm-hmm.
these whole thing, the whole process is the number of eggs keep decreasing,
Mm-hmm.
right? So if I were to extract my eggs now,
Mm-hmm.
would it impair my egg production
No.
capability or something like that?
No, no. Egg freezing it doesn't impact your woman's fertility, not at
Okay.
all.
Okay.
However, it's like only the ovarian stimulation. The washout of the hormonal injection is very short.
Right.
You need not worry on that aspect. It doesn't decrease your fertility.
Right. So, just trying to understand this better. Um, does it come with, so now that I'm extracting my eggs, will I get mood swings like, hormonal? mood swings like
Not
that?
much. Yes, some patients might complain during
Right,
the procedure. They are having mild headache or breast tenderness.
right.
Nothing much.
Nothing
It's a
much.
mild symptoms change,
Okay,
and it's a matter of only 8 to 12 days.
okay.
Not much.
Wouldn't be really putting a break on my life per se
Not
for
at
the
all.
8 to
Not
10
at
days.
all. Many of my patients are patients visiting to our IVF center. They are working women.
Okay,
Nowadays, most of the women are working.
right.
We usually advise them
Mm-hmm.
continue their work,
Mm-hmm.
come for the injections, and you
Mm-hmm.
can carry on. Only on the day of pickup, we'll require you
Mm-hmm.
for till evening. That day
Right,
they are usually on off. Otherwise, they carry on their duty works as usual.
right. Okay. Another, I'm sure it comes up very frequently,
Mhm.
is the cost factor.
See, yes, cost is also involved in this because injections are little cost on the costlier side, and that usually depend. The cost actually depends on the area what you have chosen,
Hmm.
where you are doing your egg freezing. So
Hmm.
different states will have their own cost. Roughly, it might vary between 90,000 to 1.2 lakhs.
Okay.
And yes, there are yearly maintenance involvement also. That
Okay.
depends on the clinic where you visit. You can inquire what is the roughly cost of it at that particular
Okay.
center.
Okay. Also, overall, as per the number of cases that you have handled, as per, I'm sure a lot of patients have come to you at different age groups and different, to get their eggs frozen. Um, is the success rate similar for all of them?
No, no, no. As I discussed,
Hmm.
at different age, the success rate declines very drastically.
Mm-hmm.
That's why the whole game is about freezing your egg at the right age.
Right.
Because if you are freezing your egg at a later age, as I
Mm-hmm.
discussed, and suppose you're freezing your egg after 36, 38, the egg quality has already started decreasing.
Hmm.
And yes, never the it's like it's better than not freezing at all,
Right.
but age do impact your number and quality. So plan it at the right time. Meet a specialist at the right age.
Okay. Cool.
Are there one more
So,
question I think there it is. Are there any alternative to egg freezing for fertility preservation?
right.
See, yes, you do have an alternative if you're having an option, you're married or you have a partner whom you want to have a child with,
Mm-hmm.
you can always freeze your embryos also.
Okay.
Suppose a female is married
Hmm.
but has been diagnosed with some, God forbid, a cancer,
Mm-hmm.
and she has not had any baby yet.
Hmm.
She can always come to us for egg freezing, and we can she can undergo the whole process as I told you of stimulation, extraction, and we
Mm-hmm.
can freeze. We can fuse her egg with the sperm, husband's sperm, and
Okay.
form an embryo,
Okay.
and we can freeze that embryo
Hmm.
for the n number of years the couple wants.
Hmm.
Uh, Embryo freezing embryos which are frozen have a better success rate than egg freezing. It
Okay.
is proven.
Okay.
So yes, if a patient couple is ready, we can give them an option of embryo freezing rather than egg freezing.
Okay. That is also an option.
Yes,
Okay. And that is more successful
yeah,
than egg
it has
freezing?
better success rate than only
Okay.
egg freezing.
Oh, okay.
But that doesn't mean you will not give up at all. Egg freezing is always the better option if you
Right.
are single yet. Yeah.
Right. Uh, what else? Are we getting any certificate? Uh,
So
okay.
one more question is there.
Documented egg freezing, fertility prevention. Okay,
Is there
that we
any
have covered.
chance of cancer due to medicine? No, not at all. It's as I told you, the wash of time is very less. So there is not yet proven any chance of cancer due to medications. No.
Okay. There is no scope of cancer. कोई खास तैयारी की जरूरत पड़ती है एग फ्रीजिंग से पहले?
नहीं नहीं ऐसे कोई आज मैंने बताया कोई स्पेशल कोई तैयारी नहीं करनी है वो आप एक डॉक्टर से आप जब मिलेंगे वो आपको सब गाइड करेंगे आपके बेसलाइन हार्मोनल टेस्ट कुछ होते हैं जिससे हमें पता चल जाता है कि क्या आगे हम कैसे बढ़ें तो आपको पीरियड्स के सेकंड डे बुलाते हैं आप अपना काम रूटीनली वैसे ही करें जैसा आप कर रहे थे ऑफिस वर्क सब कंटिन्यू रहेगा आपके सोई जैसे कुछ इट्स मैटर ऑफ 1 to 2 weeks जो इंजेक्शन लगते हैं आपको और जब रेडी हो जाते हो तो वो हम एग निकाल लेते हैं and you are discharged. You go happily home. Normal routine activities you can carry on with your work very next day.
Right. Okay. How many years can an egg embryo be frozen? I think we
See,
talked
egg
about
and
this.
embryos can be frozen for a number of years you want, but Government of India allows us to freeze any kind of gamete for 10 years. So we have a limit of 10 years.
Okay. All right. Any other questions that we have come across? I think we touched on the expense bit also.
Yeah, that I've
Yeah.
said can be according to the center you visit.
Are there any lifestyle changes or precautions to take during the egg freezing process?
If you are doing it, if you have time and you're planning for egg freezing electively, you can, and if you are suffering from any kind of medical problem as well, like diabetes, obesity, or any kind of you have smoking, any kind of other habits you have, you can just withhold these things for at least 1 to 2 months. You can should avoid smoking, avoid excess caffeine intake, avoid alcohol, not much. Secondly, yes, if you are on the heavier or obese side, you should decrease your weight. You can have a healthy lifestyle for 4 to 6 weeks, and then you can always come back to us for egg freezing.
So it is more or less the same preparation that we would otherwise take for pregnancy as well, right?
Yeah.
I mean, that is what gynacs tell us, time and time
So
again that
less complication if you at all
yes,
in the pregnancy. And
right,
for egg freezing, it's good for us. The quality of egg will come better if you have a proper lifestyle.
right.
You are maintaining, as I told you, all the precautions before egg freezing.
So a good healthy lifestyle is
Yes,
very essential for
always.
any procedure to work
Right,
out
right,
well,
right.
right?
Hmm.
Okay. Uh, hmm. Any other questions that we might be having? Okay. Are there any risks or side effects associated with
No,
egg freezing?
as such, no major risk is involved with egg freeze. You should not be afraid of it. It's a daycare procedure, and no, usually not.
So basically, I'm mentally prepared. I'm ready to freeze my eggs. I walk in, I do a daycare procedure, carry on with my doctor who will
One
be
thing I
happy.
want to discuss the side effects associated with egg freezing. As such, you will not have any major side effects if you
Okay.
visit a good infertility specialist.
Okay.
Nowadays, many protocols have come up which will not have a otherwise any kind of ill health benefits or any post operative complications on you. So the whole it lies in where you are actually taking your treatment. So when you're
Right.
visiting a good and a certified IVF clinic, you will not land up in any kind of risk, I suppose.
All right.
Hmm.
That is good. What is the ideal age to freeze eggs?
See, yeah,
This is a
Shraddha
dicey
touched.
question.
It depends on you, actually. I always say, if you are like coming approaching to 35
Hmm.
and yet you have not decided to get pregnant with any kind of reasons, as discussed earlier, any kind of medical reasons. I mean, I'm sorry, or if you have decided, okay, I want to freeze my egg and I'm 34, 35, and still if I don't want to plan my pregnancy yet, I will
Right.
always advise to freeze your egg.
Right.
And as such, there is no demarcation of ideal age. You
Right.
can plan at 30 years also. Okay, I have made my mind. I will not get pregnant for another 6, 7 years, say. So freeze your egg at 30. It will have
Right.
very good success rate.
Right.
We people not have to freeze your many eggs. Even 10 to 12 eggs will be also sufficient for us to give you pregnancy.
Right.
So
Right.
it's all depend on the person. Till
So
when they are okay with
So
it.
in this, I have another query. So most of, in cases of people who have PCOS or PCOD, right?
Yes.
They also have complications in their periods, and sometimes they are suggested to have this course of contraceptives,
Yes.
right? So
Yes.
suppose somebody like that wants to get their eggs frozen.
Mhm.
Will there be a certain kind of precaution needed for that? Will that impact my eggs? at all?
See, yes, I think PCOS is actually a good for a fertility specialist because we
Right.
get lot of egg, and yes, some in PCOD the other problem is quality of egg declines.
Right.
Its quality is sometimes not poor,
Right.
but other positive aspect is the number of eggs are good.
Okay. Okay.
So if you want to freeze your egg with any kind of reason, you can come to us. We can
Right.
freeze your egg. Lifestyle, yes, we had always advise a PCOD patient to have lifestyle modification, and as we can discuss later, if she wants to freeze, we can do it.
That's
Yes,
doable,
yeah.
right? There's no. Okay. Okay. Namrita wants to do it. She's 40 years old and she's met a gynecologist in Gurgaon and she has checked me and found 7 eggs. She asked me to go for IVF. What would you suggest?
Yes, she should be going as she is already approached the age of 40. She should definitely undergo IVF. Yes, baseline investigation, the doctor might be doing it, EMH test, and there are another infertility panel test. And because after 40, the natural chances of conception declines.
Acha.
And I assume till now she might have done lot of treatment,
Okay.
and it will be late if she again delays it, because at the age of 40, as I discussed, the chances will be decreased even in the IVF. Also, we have 30% of chances of pregnancy after 40.
Okay.
So please do meet a doctor, IVF specialist soon, and undergo IVF.
Namrata, if you find this information viable, then we have our details in the description of this video. Please feel free to contact us, reach out to Dr. Priyanka also. I'm sure she'll be able to help you out with this
Sure, sure.
completely, right? Okay. What else do we have? How many eggs are extracted for egg freezing? Okay, this number varies, right?
Yeah,
Like you
this
said.
actually number varies. We don't have any fixed number कि भी इतने ही eggs होंगे और इतने freeze होंगे, but हमारा एक target होता है. अगर एक suppose young female है और मेरे पास एक good number of eggs मिल गई, 30-32 पे आ रही है, तो मैं चाहूंगी उसके 10 से 12 egg मेरे पास freeze हो जाए, ताकि अच्छा सक्सेस रेट मैं उसको दे सकूं जब भी वो मेरे पास वापस आए प्रेगनेंसी के लिए. और वहीं अगर मेरे पास पेशेंट मिड 30s में आती है, तो मैं चाहूंगी थोड़े ज्यादा एग मैं उसके फ्रीज कर पाऊँ कि
अच्छा.
ताकि एटलीस्ट हमारा मकसद ये है कि जब वो आए हमारे पास हम उन्हें प्रेगनेंसी दे पाए.
Right.
आईवीएफ एज सच 100% सक्सेस रेट नहीं होता है, तो इट्स ऑल अबाउट द एज गेम.
हाँ.
अब इसलिए ही जितनी एज होगी उस हिसाब से डॉक्टर डिसाइड कर लेता है कि इतने मेरे पास एग्स हों. बट अब कुछ गाइडलाइंस भी हैं, कुछ रूल्स रेगुलेशंस भी हैं, तो वी हैव टू डिस्कस विद योर डॉक्टर कि भाई मेरी एज क्या है, उसके अकॉर्डिंग हम इंक्रीज करेंगे. आपके कितने नंबर है, कोई डेफिनेट नंबर वी कैन नॉट से.
इट ऑल डिपेंड्स ऑन आपके बॉडी
Yes.
कॉन्स्टिट्यूशन में, आपके
Yes.
टेस्ट के रिजल्ट्स के ऊपर. एंड आई थिंक
आपकी
आपने जो
एज
बोला
क्या
था
है.
हार्मोन टेस्ट एक होगा, तो उसके
Yes.
बेसिस पे आप आइडेंटिफाई करोगे,
हम्म,
राइट? सो या दैट मेक्स सेंस. ओके. एनी अदर क्वेश्चंस?
chance of
I think that is pretty much it. I think we covered everything. Does this come under insurance?
See, as such, government, I mean, in India, I don't think so. Any insurance company is giving
Right.
insurance, but
Because I'm
I've
sure
heard,
this is a new
yes,
new
I
thing that
have
they're
now,
still
it might
discovering.
come in future. Many
Of course.
insurance company might cover this.
Right.
At present, what I've heard is Apple, Facebook, Google, they actually allows give insurance to their employees. That's,
Okay.
you can confirm it, but that's what I've heard.
That's what you've
They
heard.
give the
But I think this is a good option in terms of realistic goals in life. I think this is a good option to go
Yes.
for. It's whether insurance or not. I mean, at this point, even
Yes,
I mean,
yeah.
I speak for a lot of people my age in their 30s who would want to still wait a little longer and probably get this done.
Yes, you should, because when ऐसा ना हो ना कि आप हमारे पास जब तक आए और हम कहीं एक ही नहीं है या बहुत
Right.
हम आईवीएफ में भी आपको सक्सेस रेट इतना नहीं दे पाए और
हाँ.
फिर रिपेंट करें.
हाँ.
बेटर कि आप समय से आ जाए हमारे पास.
ठीक है. समय से आना is the main important
Yes.
और क्या, I'm scared to get pregnant at the age of 40. Okay, Namrata has concerns.
Okay.
Doctor said bring your husband and you can get pregnant easily, but I have a doubt if my baby would be healthy at 40 or normal delivery.
सी नम्रता, डोंट वरी, ऐसा ऐसा जरूरी नहीं है कि आप 40 इयर्स के हैं तो बेबी अनहेल्दी ही होगा. इट्स नॉट कंपल्सरी. मेरा कहने का मतलब है, यस, चांसेस थोड़े से हायर साइड होते हैं जब आप एडवांस्ड एज की तरफ जा रहे होते हैं, बट दैट डजंट मीन कि सबके साथ ही होता है. देयर आर हंड्रेड्स ऑफ टेस्ट, देयर आर मेनी टेस्ट नाउ कमिंग टू मार्केट. आप प्रेग्नेंट होंगे एक बार तो देयर आर नाउ NIPT, amniocentesis, मेनी टेस्ट एंड हाई लेवल स्कैन्स आर डन जो डिटेक्ट कर लेते हैं कि बेबी में कोई प्रॉब्लम है कि नहीं during the antenatal period also. And if you are skeptical and if you are undergoing IVF, your doctor can give you an option of PGS also, pre-implantation genetic screening.
Okay.
उसमें क्या होता है, हम एम्ब्रियो को टेस्टिंग के लिए भेजते हैं टू रूल आउट एनी काइंड ऑफ मेडिकल इलनेसेस और एनी इश्यूज विच कैन कम अप उस एम्ब्रियो में. एंड जो भी हेल्दी एम्ब्रियो होगा उसमें से हम चूज करके पेशेंट के यूट्रस में डालते हैं. So
अच्छा.
either way, uh, she should not be afraid of, because pregnancy is a bliss and motherhood is a bliss. You should keep on trying.
Sure.
Should never lose hope.
Sure. Okay. Can frozen eggs be used for both personal family building purposes or for donation? Can eggs be donated? I've heard of sperm donation.
Yes, that's a whole different topic.
Okay.
You can nowadays, that's a whole different topic. कि भी डोनर एग है, पेशेंट इज फॉर डोनर एग. कई बार क्या होता है, हमें फ्रोजन एग, गवर्नमेंट ऑफ इंडिया अलाउज फॉर द डोनर programs.
Okay.
You can use the frozen egg,
Okay.
provided all the things have been करेक्टेड, चेक्ड, एवरीथिंग. हाँ, अगर आप किसी पेशेंट ने अपना एग फ्रीजिंग कराया है, उसको आप कहीं और यूज नहीं कर सकते क्योंकि गवर्नमेंट ऑफ इंडिया हमें लॉ के अकॉर्डिंग अलाउ नहीं करती.
Okay.
एंड अगर आप खुद ही अपने क्योंकि जब भी हम एग फ्रीज करते हैं हम एक कंसेंट साइन कराते हैं आपसे कि आप कहाँ इसको यूज करना चाहेंगे फॉर साइंटिफिक पर्पस या आप कहीं डोनेट करना चाहेंगे. वो एक पेशेंट को एक फॉर्म दिया जाता है, वो उस पर टिक करता है एंड गॉड फॉरबिड कुछ पेशेंट को हो जाए तो व्हाट दे वांट टू डू विद देयर एग्स पोस्टमसली, वो सब हम प्रायर ही करा लेते हैं. जैसे ही हम ये प्रोसीजर करते हैं उसी टाइम एक फॉर्म होता है, उसके अकॉर्डिंग डिसाइड होता है कि जो पेशेंट ने अपने eggs से जो करना चाहेगा.
ओके. तो मतलब मेरे, आई मीन, इफ आई वांट टू फ्रीज माय एग्स और कल किसी भी कारण आई कैन नॉट गेट थ्रू द प्रोसीजर और शायद आई डोंट ऑप्ट itself कि मुझे, I don't want to have a baby, but those eggs are
Then there will
viable
be an option
for
for you.
others.
You want to discard your eggs.
हाँ.
You want to give the egg for any scientific studies or something,
Right.
or you want to donate. That will
Right.
be in your hand.
Okay.
Whatever you will say and tell us the doctor, they will be doing accordingly.
Okay. That helps. All right. एग फ्रीजिंग का कोई कॉम्प्लिकेशन भी होता है या फिर ये सेफ प्रोसीजर है?
ये मैं डिस्कस कर चुकी हूँ. इट इज सेफ प्रोसीजर. You
It's a
should, if I go with the benefits and the disadvantages, benefits are much much more. A mild, I told you, mild pain of injections, little discomfort, that's bearable. That much complication, nothing else,
right.
nothing major.
Nothing major. और जैसे आपने बताया, it's a daycare procedure.
Yes.
So your life will not be hampered. You will
Yeah.
continue doing what you're doing daily.
Find a good doctor for
Find
it
a
so
good
that
doctor.
there
Yes.
is no
We have a good
complication at
doctor
all.
here. So again, I'm repeating. We have our details in description, our contact number, our website. You can reach out to us. You can reach out to people like Dr. Priyanka who are ready and always there for you to give you proper guidance in this matter. And like we properly established that एक तो बड़ा factor है कि आपको आपको deal कौन कर रहा है, as in who is looking after you, right? The doctor and their skills are pivotal in this case.
Right.
Apart from that, we have to also maintain a healthy lifestyle to
Definitely.
be able to get into this next stage in life.
Yes.
Okay. Another question that we might be having is there any legal considerations for egg freezing? कुछ formality ऐसा कुछ है?
As such, legal formalities यही है कि आप अपने egg freezing करा सकते हो, but they cannot be used by somebody else. It can be used by the person herself and that's so for the 10 years.
Okay.
That's और कोई इतना legal complicalities नहीं है.
So are there any ethical guidelines that you have to follow for egg freezing? ऐसा कुछ like is it a very well structured legally and otherwise system? Because इसलिए पूछ रही हूँ क्योंकि ये नया concept है, right? Lot of people tend to mislead you.
Egg freezing is very much legal in India.
Mm-hmm.
It's, as I told you, if a female wants to freeze her egg, it's her personal right.
Right.
She wants to freeze at a younger age. She has
Right.
decided not to get pregnant for another few more years.
Mm-hmm.
And she has every right to freeze her own eggs. And later, if she wants to get pregnant, it's very much legal in our country.
Mm-hmm.
You can be doing it. The time limit is only framed.
Mm.
We can follow that and she can plan later on pregnancy. As such, nothing else.
Right.
No.
ठीक है.
Mm. So,
Okay.
sorry,
Very
so
technical question. Can frozen eggs be used for gestational carrier arrangements? Or what are these?
No, actually, this is a very controversial topic nowadays.
Okay.
Because yes, surrogacies from last 1 year, lots of implementation gadgets have come out from government of India.
Okay.
They are still under considerations.
Okay.
A single woman wanting it's actually allowed for frozen egg, but still, government is giving new guidelines, and it's yet to be discussed later. It's a whole good big topic on that.
Okay, fine. But as a person who wants to decide and plan their pregnancy, I can choose to get my eggs frozen
Yes.
and proceed on it. There is no embargo, there's no legal formality, extra, whatever. It's my choice. Just have to
Yes.
find the right doctor
Yes.
who will be as good as you.
In your city, or you can choose one.
Sure.
Yes.
All right. All right. What other medical conditions? So, another question is a lot of cases that we hear in hospitals is diabetes. That can be a concern, right? So, like a lot of surgeries can't be performed because of that your diabetes level, and if you're type 1 or type 2, there are complications and etc. So, does that also apply to egg freezing? Specifically, I'm
yes.
asking this because it's a concern. A lot of
Yes,
people
yes.
do ask.
See, when patient is supposed diabetic, then yes, our egg freezing is an elective process. If she is
Right.
doing for her personal reasons,
Right.
we can always stabilize her diabetes. There's a test called HbA1c. Her sugar levels are monitored.
Okay.
We'll always bring her sugars under control
Okay.
before doing any kind of surgical intervention.
Okay.
She can always meet a diabetologist, and where she's given a few medication, whether it is controlled on tablets or injected insulin or something like that, the doctor will decide. Once her sugar are controlled, then she can meet us and we can go ahead with the process of egg freezing. So basically, any kind of medical illness, फर्स्ट यू पहले आप कोशिश करें कि उसको ठीक होए वो, क्योंकि हमारे पास टाइम है अभी कि भी आपका अगर सपोज अगर आप हाइपरटेंसिव है, बीपी ज्यादा है, आप उसे कंट्रोल करें, शुगर है तो उसको कंट्रोल करें, तब आप एक फर्टिलिटी स्पेशलिस्ट से मिल सकते हैं. इसको ज्यादा टाइम नहीं लगता है. एक गुड एंडोक्राइनोलॉजिस्ट 1-2 महीने में आपका शुगर कंट्रोल हो जाएगा एंड देन यू कैन कम बैक टू अस. तब हम कर सकते हैं फ्रीजिंग आपकी. प्रॉब्लम जब आता है जब कोई मेडिकल रीजंस की वजह से फ्रीज कर रहा है, सपोज मैंने आपसे डिस्कस किया कि कैंसर है, तब हमारे पास ऑप्शन नहीं बचता ना, हमारे पास टाइम होता है इतना. फिर भी नाउअडेज सेफ हाइजीनिक प्रोसेस है पिकअप, अगर प्रॉपर ढंग से किया जाए, गुड एंटीबायोटिक देते हैं, इतना कोई प्रॉब्लम आता नहीं है.
अच्छा. Okay. So just like any other pregnancy, I'm sure her pregnancy mein, when we plan pregnancy, we do deal with these kind of things. Similar it is for egg freezing as well. And again, reiterating that previous point, lifestyle is important.
Yes.
Being fit is important for things to be viable in the long run. Okay. Right. Then बचा सिर्फ एक ही question. How do we reach out to you?
So we have a number and address in our description box. You can always contact us and book your appointment with us. We will be really help. It will be our pleasure to help you regarding the same egg freezing.
And at least I can vouch for this. This is a judgment-free zone. I felt very comfortable talking to you about these things.
Thank you so
And
much.
thank you for putting me at ease to discuss so many concerns. These were some of these were my own personal concerns that you did answer. So thank you. And I hope this bit of information that we shared today was actually helpful to a lot of you. Because see, learning about these new terms comes with a lot of myths and a lot of anticipation कि क्या सही है क्या गलत है क्यों क्यों करे वाई शुड बी प्रोसीड विद इट हमारे पास मतलब इससे हमारा क्या होगा विल इट एक्चुअली हेल्प अस सो इतने सारे क्वेश्चंस दे जस्ट कीप गोइंग अराउंड इन आवर हेड्स इन इटसेल्फ एक फ्रीजन सुनते ही थोड़ा अजीब लगता है ये क्या अजूबा सा कुछ होने वाला है लेकिन ये है नहीं इतना अजूबा आई मीन अगर आपने हमें पहले से ज्वाइन किया हो यू विल नो that it is such a blessing for people who get diagnosed with cancer, especially given that India में अभी cancer के cases, especially women related cancer के patients ज़्यादा है. More people are suffering from breast cancer, ovarian cancer, and the likes of it. So, given that this does not discriminate with age, cancer, it does not discriminate with age. So, we should be prepared with the options that we have in hand. So, it should not be too late for us to, opt for or plan for our lives because sometimes early awareness actually is the best way to deal with cancer. And if and how we get rid of cancer from our lives, we can lead a normal life. And in that normal life, we can plan our own pregnancy, provided we have decided to freeze our eggs beforehand, right? So the more viable they are, the better it is, the higher the success rate. Right. And of course, you have to have a healthy lifestyle. You cannot, there's no arguments on that. That's a non-negotiable bit, but our doctors will help out in whichever way that they can. So, if this is important to you, if this makes sense to you, egg freezing is a wonderful thing to do. And thank you, doctor, for putting a whole lot of spotlight onto egg freezing and chatting with me all this way and answering all these questions that I kept shouting at you. But I hope इससे लोगों का benefit हो, and that is the whole purpose of this video. I hope you guys like it. And if you have any concerns, leave your messages in the comments. We will get back to you and we will get back to you with our doctor's opinion. And if you really want to reach out to our doctor, our number, our contact info is in the description. If we have one, okay, we should take one more question. Can frozen eggs be used by same-sex couples or single individuals who wish to have biological children in the future? This is a unique question. We should answer
See,
this.
actually, now this is also a controversial topic which is very much going in India nowadays, same-sex couple.
Hmm.
Although Supreme Court has almost legalized the marriage, but it's in IVF, it's you can use your frozen egg and can later on be used. Yes, it can be done, but it's a whole still a controversial topic to discuss on.
Right. So scientifically, it's possible. We need to wait for the rest of the things to fall in place. But whenever we do have everything working out for us, our doctors are here to help you in every which way that they can. Right? For healthy pregnancies and
Sure.
happy families. All right, doctor. Thank you so much.
All right.
I hope to interact with you in future again on
Sure.
something more interesting.
Yeah, please.
Yeah. All right. Thank you, guys. Bye.
And Dunya. Hi, Ram.